Does suffering in therapy necessarily mean moving forward? Not always. And it's a common confusion, especially among people who are very connected to their pain. Today, I want to talk to you about the difference between reliving your suffering and transforming it for real. In a therapeutic reconsolidation process, after identifying a pattern to transform, we enter phase B. We explore emotional memory in order to discover and integrate why it's necessary or stronger than us to react the way we do. We put words to our deepest feelings. We discover the brain's implicit internal rules, such as, if I say no, I lose love, or feeling makes me vulnerable. This step is necessary. But if the patient is alone inside the scene without an active observer, he or she may melt into his or her wound instead of integrating it. Some people are so fused with their wounded part that they spin endlessly in their pain. It's like being in a dark room. You know every nook and cranny, every wall angle. You think that by revisiting them again and again, you'll eventually find your way out. But in fact, you're just walking around in circles in the dark. We feel, we cry, we remember, sometimes intensely, but nothing really changes. A real therapeutic process, the one we're looking for with memory reconsolidation, is a different kind of movement. It's not just feeling. It's feeling from another part. It's a bit like free diving into a deep lake in search of treasure. If you go in without a rope, without a partner, without air, you end up getting lost in the algae. The role of the therapist and of the adult part of the patient is precisely to be that rope, the thread that connects you to the surface, the one that keeps us in the exploration without becoming the emotion itself. When you're too closely fused to the wounded part, you can't look inside. You're in it, you're suffering, you're exhausted. And the worst thing is that you think it's working, when in fact you're spinning in a loop that confirms the wound instead of making it explicit. The key isn't to avoid emotion. It's to go in with a living witness inside yourself. In this phase, we want to keep a double perspective. A gaze from the wounded part, which feels sincerely, and one from the observing side, which understands, supports, names, and sees the links, the connections between the two. This double focus creates the space needed for the emotional truths of the patterns, schemas to emerge and be integrated. True transformation can only occur if step B has been traversed without drowning in it. If you're wondering, am I healing or just suffering again? Ask yourself these questions. Am I reliving the same pain over and over again with no new movement? Am I experiencing a loop effect or a new perception? Does anything move, loosen up, brighten up after my sessions? A real therapeutic process leaves traces, sometimes relief, sometimes awareness, sometimes a strange peace you've never felt before. Many patients, especially if they're fused to their wounded part, get bogged down at this stage. They think they're making progress because they're feeling so much, but they're circling in an emotional sea with no active witness, no observer. Real movement is when something reorganizes itself internally, however slightly. You have every right to need a guide in this dive. Therapy is not a test of resistance to pain. It's a space of encounter between your wound and your part capable of embracing it without merging with it.